Welcome to the PM&R Scholars podcast. The PM&R Scholars is a group of like-minded individuals focused on collaboration, mentorship, research, and networking opportunities in physiatry. The Road to Residency series will feature on-demand sessions with leaders in the field to bridge the gap to residency. Follow along as you start your rehab journey.
Welcome to the PM&R Scholars podcast. Today I have Dr. Nikhil Verma, interventional pain and musculoskeletal health physician in private practice in Columbus, Ohio. He graduated from residency from Kingsbrook Medical Center in Brooklyn, New York, and did fellowship in Birmingham, Alabama. Today, Dr. Verma is going to be discussing some tips with oral boards for physical medicine and rehabilitation. We thank you very much for your attention. Dr. Verma, take it away.
Thanks, Vinny. I appreciate it. And I appreciate all those listening today. I think I want to just start out by saying the reason why I wanted to do this podcast or video recording in the first place was because there's a lot of there is not a lot of information out there for us for the oral boards. My class was the first class to take the oral boards virtually. So obviously we were all freaking out. I wish some of these tips were available to us then. I also have some tips that I felt like I used that were beneficial for me. And I've gave those same tips to some of my colleagues and they've used those as well. And some of these might sound stupid or you might like, oh, you're wasting our time with this stuff. But if you bear with me, there's some reasoning behind it all. So I think the first big thing to think about for the oral boards is you guys already know all this knowledge. It's not a specific knowledge-based test. You might need to go back and review some of those topics that you did a little bit poorly on in the written boards, and you can review your charts from your data from the previous the written boards, and you use that to just go brush up. I'm not saying you need to go study multiple hours on these things. Just go brush up the highlighted points, and that might be beneficial for you. But yeah, again, overall, it's not really testing your knowledge as much as we think it would be. It's really testing how you perform in the real world and how you would perform in the real world scenarios. And that's the whole purpose of the test, to make sure that you're competent and that you're pulling together all these portions of the physical medicine and rehabilitation realm. I'm not going to go over a lot of the details and the specifics of the test and how it's broken up by section. I think ABPMR does a great job of explaining that. They have their own podcast and web series that you can go look at and get some of that information from. I also recommend utilizing, it was an orange book when I started, I think it's a green book now. There's also a red book. Also PM&R QBank has some questions. So it is well worth your time to go through as many cases as you can. Now, when I say this, I practice in two different ways. One way was I had a colleague in my, we're sitting in my apartment across the table from one another, and they would read the questions for me, and then I would just walk them through the case and discuss it. No time, no pressure, but just making sure I was hitting all the bullet points. And then obviously they have the book with them or the answers with them, so they can easily they can at least guide you and say, hey, you missed this, you missed this. So that's the first way I started practicing and getting some more information about the test and seeing where my weak points were. With that being said, too, I think it's worthwhile to also practice with someone outside of medicine, outside residency or fellowship or whatever. And the reason I say that is because if you can explain it to them in a clear and logical manner, then you explaining it to another physician when we're taking the test, you will come off across much more clear and concise with your answers, and you'll gain some confidence. And I think that's what's important. This test is a lot about confidence and competence and how you present yourself. So I have a whole list of things I'm kind of reading and looking them over as I go through this. So there's about 15 to 20 other points. So there might be some things that run into each other, but I might also jump around a little bit. So It might be worth people to listen to this one time, and then if they come back again, to write some notes about it. So yeah, with that, let's just kind of go back off the top of my list, and I'm just going to go down one by one as well. So this one is one of the ones that people might find a little stupid, and it's doing tongue twisters. And the reason I say that is because this test has a halo effect around it, even though the ABPMR says there is no halo effect and you won't be judged on pronunciations or accents or verbal tics or whatever. But I mean, in reality, there's always a halo effect. You're always going to have some sort of quick judgment. Daniel Kahneman talks about this in his book, Thinking Fast and Slow, where there's an emotional, quick thought process about everything. And then once you have your logical brain have time to catch up, then you have time to kind of break those biases. But with that being said, I think it's worth trying at least a couple weeks up until the test to do some tongue twisters, 5 or 6 reps in the morning, 5 or 6 reps in the evening, do it in front of a mirror. And it's going to help your enunciation. It's going to stop some of your nervous tics. You're not going to say ums, buts, ifs, and those kind of things. And your pauses will be more meaningful. And with that being said, what you can also work on at the same time is vocal tonality. Vocal tonality, there's kind of 3 different ways that I think about this. A lot of times when we are asking a question, we'll kind of go up at the end of the sentence. So it's like, what time is it? So you can kind of hear the voice go up versus someone that's just saying a direct conversation, like good morning. You kind of say that more of an even tonality. And then there's a harsher tonality, which you kind of want to avoid, and you're talking down as if you're talking to your dogs, like, no, don't do that. So that emphasis at that bottom, at the end. So these are all kind of things you should think about, and you want to kind of maintain an even tonality when you're talking. And when I say that, I don't mean being monotone. You definitely want to enunciate and put emphasis in your words and be energetic about your answers. But the idea is you don't want to be questioning when you're answering the proctors of the test. So I hope that makes sense. But if it doesn't, feel free to reach out to me and we can talk about it a little bit more. But this is something that you should also be practicing over time and also be practicing with whoever you're practicing with. This next one is something I felt helped me immensely because it helped me calm down before the test. And that was, I did practice runs on Zoom with my girlfriend. So I was living in Birmingham and she was in Columbus at the time. And we would get online and do practice tests. I sat in the same room that I was going to sit for the test. I had the same lighting and had the same everything that you can think of for the test. And she was able to give me a lot of, one thing, she's not in medicine, so it was helpful from that point of view, but and that's why if something wasn't clear to her, she was able to tell me. But the biggest thing I felt like for her to explain to me is like, hey, I don't like how where your camera angle is. Maybe put some books underneath it, or maybe put it up on your shelf. The day of the test, you can't have anything in the room. And we'll talk about that in a little bit. But I was able to angle the camera better. So the angle that I was expressing on my face was a better angle, and it wasn't kind of looking up. You want your camera to be at eye level or maybe a little bit above eye level. And you also want to realize where your camera is. When you're talking to these proctors, you want to be looking into that camera. Don't be looking at them eye to eye in the face in the screen or looking at yourself, which can also be a distraction. You kind of want to be looking up a little bit. And that's something that's going to help you keep your thought process going. The other things with practice runs in the video is what my girlfriend was able to do for me was to give me feedback on lighting. Lighting should be brighter behind the screen or facing your face than behind you. Anything behind you was going to cause a shadow and it's going to cause a problem. So you want lighting to be more present on behind your screen. However you want to get that accomplished. Some people will use certain lights for this. For me, I open up windows that are facing my face so it help light up, and I close the other windows. I turned off the lights behind me. But again, that's why you do these practice runs. Another thing is posture and sitting. You don't want to be moving around, jumping around, constantly getting comfortable. So make sure you have a comfortable chair, put a cushion there if you need it. And just be highly conscientious of how much you're moving. Remove some of those nervous tics, like you're uncomfortable. It's going to disrupt your thought process, and it's also going to make you feel or appear less confident in your answers and what you're answering. So that's another important concept to look at. And again, I keep hitting this point, but eliminating the ums, the uhs, and that kind of vocal tonalities and vocal tics, because that's also going to help you get past this test. Each section, it goes by very, very rapidly. So you really need to stay on point and keep your thoughts linear. If you have the urge to say those ums and uhs, etc., just take that extra second to pause and take a breath and get back into it. So that's another thing to keep in mind. Speaking of, you will be allowed to have a glass of water in a clear cup for the test, and I highly recommend it because you'll be doing a lot of talking. Your mouth will get very dry, so it'll be helpful to have those sips of water in between questions. And I have my water right here today, so as well. The other things in the day of the test that you're going to have, you'll have a piece of paper that's allowed, and you'll have a pen or a writing utensil. You'll have, I think they will check an ID, and there really can't be anything else in the room. So it might take some time to clear out a room to have everything out. No books, no posters, no pictures, no other scrap paper, nothing like that. So you really want to clear out that entire room. It might be difficult for some people, but that's just something to keep in mind. And people might be noticing, I'm saying and ofs a lot. It's because I haven't been practicing this. If I was, then I could probably eliminate these a little bit more, but I haven't been practicing it. So just something to keep in mind. I didn't want to sound too hypocritical, but I'm not taking this test in the next few weeks or the next few months. So, all right, the next portion we will talk about is the stoicism that the proctors will display. It's not real. They are told to be very stoic in how they respond to you. They're not going to give you any visual confirmations or the opposite confirmation of your answers. They're not going to nod their head yes and no, be like, yeah, you're on the right track. Or they'll be like, won't be shaking their head no, that you're way off course. They're just going to be stoic and look at you, and it's a very uncomfortable feeling. My recommendation is get used to that feeling. When you're doing these practice runs online, that is kind of what I'm talking about. You want to have these people be stoic on the other end. And even, I would even say, kind of be mean on that side, because once you get used to that, then you can start being comfortable in your answers in the test and allow the test to flow section by section and question by question. Or question by question and section by section, I should say. So just keep that in mind. They will be very stoic, and it's so hard to understand that. You're going to get this repeating questions of go on. They want you to keep elaborating. They want you to keep elaborating. They'll keep asking anything else. So continuously give them the best information that you can give them. So let's see. With that being said, after the test, you're going to be like, oh my gosh, what happened? That was so hard. I can't believe I didn't prepare for that. I think I failed. All these things. These are normal feelings. I think everyone feels them. Everyone I talk to has felt that. And I do believe that they make the test like that on purpose to make you feel like you're inadequate or you've done something wrong. But in the reality, if you answer the questions appropriately and in the time allotted, and you move to section by section with a reasonable thought process, then you won't be docked a lot of points for those kind of things. So keep that in mind. Again, it's not a knowledge test as much as you think it is hitting those highlighted points that they're looking for and moving across a case appropriately. Let's see. The next thing I want to talk about is connection. So if this is, on a Zoom link or whatever online platform that they're using, you should keep in mind that your connection might not be the best. You don't want to risk power outages or poor Wi-Fi signal that day. So if you could ask your colleagues in your house, if you're living with roommates, your wife, kids, parents, or whoever's might be staying with you at that time, if they could turn off their Wi-Fi devices while you're taking your test. Better yet, if you could get them out of the house so you have the peace of mind for that time frame. Not always possible, but it's helpful. There's also these connection Powerline Ethernet adapters where you will plug in the one end of the adapter to the wireless router, and then it pretty much makes any outlet throughout the house wired connection. You can get those on Amazon for about $40 to $50. It might be worth looking into because you do want a high quality internet connection so you're not freezing and pausing and all that kind of stuff. We did talk about the presentation and how you want to have some practice on a video with somebody. The other things you want to look for is not just the lighting, but you want to say, take a look at is there an echo in the room? You should have some headphones for the test. I have the earbuds in right now, but you should have some earbuds to take you through the test too, so it's not echoing and you can hear the proctors clearly as well. And, continuing on that, there's just the halo effect of just, make sure you are presentable that day. I know this might sound obvious, but I think a lot of people underestimate, it really does go a long way to present your best foot forward. And that doesn't mean you can't have individuality in how you dress and everything, but you should put your best foot forward, whatever that might be for you. That's another thing to keep in mind. Let's see. The last few portions I want to talk about is actually about the test itself and kind of what I experienced. I can't talk about the questions, obviously, and I can't talk about how other things in the test because it's in the ABPMR guidelines not to talk about these things. But I'll just give you an example. For me, I had this section and it was time to move on to the next section. And immediately when I moved on to the next section, I was like, oh my gosh, I forgot to ask X, Y, and Z or do X, Y, and Z treatment. But that section's already done and graded. So it's not worth my time to go back and try to fit that in. So what I did is I used that as a learning point for myself for the next sections going forward. But also what I did was I would say in my answer stems after I tried X, Y, and Z, then I probably would have done X, Y, I would have tried these other 1, 2, 3 things because I tried this as well. That won't go beneficial for my grade in the previous section, but it will help you get your thoughts back on organization and help you with that specific section. That's something you'll need to look into the ABPMR section stems and how they recommend for that to make a little bit more sense. Let's see. The other thing is don't get too attached to section. Again, if you're thinking in the past about what I should have said 10 minutes ago, you're going to trip yourself up in this current section you're in, and that's just going to delay the test even more. And it could possibly hurt you in that current section that you're in. So that's another thing to keep in mind. You really want to keep going quickly through each section. And once you're done with the section, let it go. There's nothing you can do to go back and fix those. So you just want to make sure you're hitting all the points you can in that next section. The other thing is in the role-playing modules, some of the questions are pretty far out there. I think the important thing is to hold your ground and be confident in your answer that this is what I believe in and this is what I'm going with. And if there's something that comes to mind, you're like, oh, it's completely wrong. What I would really do is this. That's one story. But if you're, for example, they're trying to push you offline or whatever, I think one of the examples we commonly get is an opioid for treatment that's not indicated. You you know what's indicated or not for an opioid. So you would know not to give it to that patient, even if they were begging, et cetera, et cetera. Again, this is the role-playing section. So just keep that in mind. You want to hold your ground, be courteous, be nice about it. It is role-playing, so you would talk to them as they were a patient or a family member of the patient. So just keep that in mind as well. Let's see. Those are the major points that I wanted to tackle, and I want to leave like more of the knowledge-based stuff or the questions that you might come across the test based off those resources that are already out there. I just found these tools to help me feel more comfortable and confident when I took the test. It's still nerve-wracking. I was still sweating bullets the morning of, running around nervously, trying not to drink too much coffee, so I wasn't bouncing off the walls. But we've taken so many tests in our lifetime. This is just another test that we got to take. You just should be conscientious of how you're studying, and you should be practicing. And I think that added benefit of taking practice runs and setting up your video and doing video practice runs will help you feel more comfortable the day of the test. With that, yeah, Vinny, if you have any specific questions, I'd love to answer them. Otherwise, we can just kind of have more of a conversation and see what goes from there.
Absolutely. Thank you so much for all the information that you shared with us. Some of the questions that we had sent to us, in terms of environment, do you recommend going to a library on the day of the test, or going to kind of like getting a hotel room and maybe spending the day in a hotel room that you have safe internet connection, the environment is clean and ready for you, that you can have everything that you need, and obviously it will be much quieter as well. So what are your recommendations in terms of that?
Fantastic question. I did hear people going to hotels, and I think that's a good idea. I think a lot of people that were in fellowship, because the test was on a Saturday, they asked if they could come into the office and use their fellowship director's office or just their own fellow's office on a Saturday to do the test. So that they, like you said, away from distractions. That I would not recommend going to a library or coffee shop, because there's just so many unpredictables that might happen in that scenario. Hotel does seem reasonable if you can afford it and you want to get away from everything. Set up the night before, get there, get a good night's sleep, do your practice runs. The test goes by very, very quickly. It'll be over before you know it. So once you get started, so that's another thing I didn't mention, but I did think it was a good time to bring up now. With that being said, in those environments, you will need to make sure that you don't have books out anywhere, paper anywhere, all that kind of stuff. So you will have to take the time to clean up and make it not look like you're cheating or something.
Absolutely. That's a great answer. Thank you for sharing your thoughts on that. Another question that came in was, in terms of a connection between the proctor and the applicant. I don't know if this happened to you, but it's certainly a possibility considering that the physical medicine rehabilitation world is small and everybody knows each other. How do you recommend to act in a situation where you know your proctor, either in the same institution or you've met it before and it's somewhat of a less formal relationship? How would you recommend to act in such a situation?
Yeah, so they're supposed to ask the proctors if they do know you at a relational level. Obviously, a lot of these proctors know lots and lots of students or residents and now fellows or attendings. So with that being said, they're not supposed to match you up. So keep that in mind. It definitely happens. So when it does happen, you will act like you do not know them and they will act like they do not know you. So just keep that in mind. Some of these people you'll be at a first name basis with because you would be at attending level, right? So some of them you are that friendly with, but you should note that in this specific environment, you should be courteous that they are simply a proctor, and you can just push pause on that relationship that you have with them.
Awesome. That is great information. Thank you for sharing that. I think the role playing may be the most difficult part of the test. So how would you, what suggestions do you have in terms of particularly the role-playing scenario, how to answer, what are the things that the proctors and the exam itself are looking for, some of the things that you may suggest to make sure that we cover everything that is needed, particularly under that segment?
Yeah. So, in all honesty, these are the kind of things that patients will come to you in your clinic or on the rehab unit and ask you, is like, hey, I really read about this medication. Can I start it? Should I start it? Why aren't you putting me on it? And they're going to press you and keep pressing you like, hey, I really read about it. I really want to try it. I really think it's the next best thing. And it's very similar to how we have patients in clinic who also would want an MRI for something that's not indicated. So just keep that in the back of your mind, and you know what the indications are. You know what's right or wrong. You know what the studies show. You don't have to be so worried about that. And that's where that point comes back in, is you need to really be confident you know that information, and you know when it's indicated, and you know when it's not indicated, and you know when a new medication is indicated or when not to use it. So you know you're doing the best thing for the patient. If you keep that in mind, you should go a long way, and don't let anyone knock you off your path for that.
That is excellent. Thank you again. I think another common question that we get asked a lot from, when we are doing practice runs in residency or with fellows is how to address the answers to the proctor. Should we say, I would do this and then I would do that? Or what is your recommendation in terms of answering the questions and kind of going through the process? Like if you're going through your history and then through your exam, would you say, oh, in this case, I would perform this maneuver, I'll do this, I would ask this specific questions. Can you give us an idea about how would you answer some of those questions?
Yeah. So I think, for example, I think a good one would just be data acquisition, that portion of the test where you're kind of getting the history and physical and all that information. What you would do is kind of say, this patient comes in with back pain. It's like, okay, I would ask this patient any history of trauma, any red flag syndromes, and then I would say what the red flag symptoms are, ask for any radiculopathy, any shooting pain, any variances when they do something, what's better, what's worse. So all that basic stuff. Like, I think the point is to try to get as much information as you can without just sounding like a robot. I think what they want to see is that you're being personable, you're thinking it through actively, and you're getting the highlighted points. They're not going to deduct points if you don't get every single solitary little thing, but what they really want to see is you going through the workflow in the live time with the patient of how you would work this patient up and what questions you would ask them. So my recommendation would be get as much information as you can and as quickly as possible. If you forget something, and you're still within that section, you can always say, like, there's something I forgot to mention. I would also ask for this, this, and this. But once they say, all right, we're moving on, and then you move to the next section, it's not going to be beneficial to go back into that information. So you just got to use the information you're given. And the proctors will also guide you. So they'll also say for whatever reason, I forgot to get a back x-ray for a patient. They would kind of guide you and like, are you sure there's no more tests you want? And then for whatever reason, say I still forgot. Okay. What they'll do then is, okay, well, the back x-ray results show this. So then, I forgot to ask about the back x-ray. Okay, I might have lost a point there. But now they told me the information that I need on the back x-ray. And then you can build your case off that, what's given. So I know I didn't answer that directly because I think it's a tough and individualized thing, but I hopefully gave you some clarity on it.
Absolutely. I think there's definitely, you definitely offer some good suggestions there. In terms of like, in a situation like you mentioned that let's just say that you did your data acquisition with history and physical and your differential diagnosis. And then once you receive the answer from the proctor on your differential diagnosis and testing, you realize that you were a little bit off, on which the answer should be. How can, what any recommendations or suggestions on how to kind of put yourself back into the correct track there. Well, let's just say you realize that it was a case of, you were thinking lumbar radiculopathy, but it turned out it was more of a kidney stone or whatever, a situation a little bit off. How do you what suggestions do you have to kind of get yourself back on track there?
Yeah, it's a difficult one to answer because I don't know exactly how the proctors are scoring those sections. I can be honest with you. There was at least 3 sections where I kind of did the wrong workup and I had the wrong diagnosis in my mind, but I was still able to pass because I was able to hit the highlighted points of the other sections. And I was able to break them through to make the story the argument I was having for my case. So without going to say like, oh, I think it's this, so I do this. I think that's the problem. You don't want to lock yourself into a diagnosis. What you want to do is be broad enough to encompass everything. And then what you're doing is kind of narrowing it down section to section to section into a working series of diagnoses and not a single, oh, this is definitely it for sure, moving on. If you do that, then you're going to get yourself in trouble. But if you keep thinking about things broadly and not ruling anything out until they're definitely ruled out, then I think you're going to keep yourself safe. And again, if you do mess something up and you get the wrong diagnosis, don't worry about it. Move on and continue to answer the questions appropriately as if you answered the diagnosis correctly.
Yeah, that's great. That's reassuring because it kind of helps us understand that this test is really kind of trying to make sure that you hit all the highlights with all the different sections, even though you might have gone a little bit off on one or two directions. You can always complete all the check all the boxes and do well. Excellent. Well, thank you for sharing all this information. What I'd like to do is within the next couple minutes or so, just give us like a summary about what do you think is the main highlight that someone can get from this conversation we had today. Give us like 3 or 4 points that you feel like it's essential that everybody should at least pay attention in terms of the oral physical medicine rehabilitation boards.
Great. Yeah, I'm looking over my list right now. I think number one and most important is practice. Practice with your colleagues and fellowship, or practice with your colleagues that are also attendings that are about to take the test. Practice with the residents, but also practice with people outside of medicine, and both practice in person, but also do the practice runs on a Zoom call. It's going to be worth your time and worth its weight in gold to do these things. Number 2 is, I think I've kind of commented on the halo effect. I think that's important. You want to make yourself presentable. You don't want, and that also includes your vocal tonality. Make sure you're speaking loudly and clearly. You want to make sure that you're not stumbling over thoughts. And this all comes with practice. But you also want to make sure that the room is okay. There's not echoes or anything else that's going to distract the proctors from answering or from scoring your test. I think that presentation portion, it's not an actual graded portion of the test, and they say they're not going to grade. I think there is some sort of subconscious bias that's going to occur. I want people to be aware of that, but I think that's when you practice on the front end. So then when you are taking the test, you'll be good to go. And then the other thing is probably just, it's not a knowledge test like the written board is. It's just a completely different test. We haven't taken tests like these very often in our life. So don't think about it like a written board knowledge test. Think about it more of having conversations with your colleagues at a conference about a case, or having a case discussion with somebody in your practice. That's the better way to think about how you're doing this, but it's compressed in time. So I think that's the thing you need to keep in mind. And then I think the other thing is just don't get tripped up. Move on to the next section. Make sure that you're hitting each highlighted points over and over. What they're looking for in each of the domains. And with that, I think that'll give you enough confidence and get you enough domain points to get you past on the test. And then you can move on to the next area of your career.
That is excellent information. Thank you so much for sharing. I think we are getting close to the end here. So I would like to thank you, Dr. Verma, for your sharing your thoughts with us. We hope this conversation was helpful to the PM&R learning community, and we look forward to seeing you again in the future. Thank you very much for your time, and thank you for joining us with the PM&R Scholars podcast. Have a great day.
Thank you, everyone.